Hello everyone, my name is Julia Krill. I'm a communications manager with World Vapers Alliance, and today we are hosting a press conference on perception of tobacco harm reduction and nicotine in France and Germany. The presentation of the report on perception of tobacco harm reduction and nicotine in France and Germany was commissioned by the Consumer Choice Center in cooperation with World Vapers Alliance via the research company InfoSapiens. The research was conducted by the research company InfoSapiens and authored by Michael Landel, the director of World Vapers Alliance, Maria Chapla, research fellow at Consumer Choice Center, and Bill Wirtz, senior policy analyst at Consumer Choice Center. The report presents the findings of two nationwide surveys on harm reduction in Germany and France. It consists of 30 interviews with general practitioners and a quantitative survey of 862 French and German smokers. The main goal of this study is to gain a greater insight into misperceptions about vaping, their impact, and to understand how to address them. In addition, the findings were compared with international studies on vaping and nicotine misperceptions drawn from several countries, showing fundamental and pervasive lack of knowledge surrounding the topic of harm reduction. You can find a copy of the survey findings on the table and the chairs. And today's speakers presenting the findings are Michael Landel, Director of World Vapers Alliance, Bill Wirtz, Senior Policy Analyst at Consumer Choice Center, Konstantinas Farzalinas, cardiologist and physician and public health expert with a lot of experience in tobacco harm reduction, and Alexander Kvitashvili, public health advisor at Consumer Choice Center and former health minister in Georgia and Ukraine. I'm going to ask first round of questions, and then we can go to questions from the audience. Speakers, you can keep your answers to 5 minutes on average. So, Bill, could you please comment on the survey findings related to knowledge of harm reduction among doctors and what it means for general practitioners?
Well, thank you, Julia. I think the underlying good point in what we found in our respondents is that more than half of the people that we asked who are smokers want to quit smoking. So that's definitely the good news. Now, of course, if people want to quit smoking, they have usually two ways to go about it. If they want to research this, they either go on the internet or they ask their general practitioner. And so that's where we get into the perception of doctors. What does your doctor think about vaping as a harm reduction tool? And what we find is that a large amount of doctors are not familiar with harm reduction in the first place. So only 3 out of 15 doctors in Germany know the term. A majority in France does, and we can speculate about why that is. And I think sort of the harm reduction principle that we've applied to narcotics, which is more pronounced in France than it is in Germany, can have something to do with that. But only very few doctors recommend vaping as a harm reduction tool for tobacco. A few doctors told us that in France that they did that, but they've backtracked since, and there's a few reasons that we've identified for why that is. One of the reasons in France is that the doctors gave is that it's not reimbursed by Social Security. Compared to nicotine patches or gums or varenicline, which is sometimes known as Champix, the medicine, which is used for those and then reimbursed by Social Security. So that's one of the reasons doctors gave why they don't recommend vaping, because especially for those on low incomes, it's easier to have something reimbursed by their healthcare providers. One of the doctors told us, quote, "I have observed patients who used vaping devices and reduced their nicotine consumption and eventually their dependency on nicotine and stopped vaping. But it's not a therapy that is supervised by the health agency or legal institutions, so I'm skeptical. I don't know what to think about it." I think there we can identify sort of a problem with health advisory boards, agencies, not necessarily following through on that, and doctors not feeling that they have the institutional support to recommend vaping as a harm reduction tool. What we have established, however, is that doctors, interestingly, do recommend to continue vaping for smokers who have already started it on their own, and I think that's a very interesting fact. What doctors do recommend, I think, is interesting in both countries, is things such as hypnosis and acupuncture, which on sort of the scientific basis we're more in the realm of pseudoscience than any real established science for quitting smoking through hypnosis. If it works for you, that's great. We don't have the scientific basis to necessarily support that. Doctors do say that they're open to innovative ideas and that they're interested in learning more about harm reduction and vaping as a tool to achieve that. However, we're not quite there yet. One doctor told us that he actively recommends vaping devices along with other solutions. He recalls the case of about 8 heavy smokers back in 2011 who gave up smoking traditional cigarettes thanks to vaping devices without consulting him in the first place. And that is why now he feels motivated to take that approach as well with other users. And I don't want to take too much time on sort of the explanation here. What is interesting is sort of the perceptions on nicotine, which diverge from the scientific reality on the use of nicotine. I think that is one of the issues why doctors feel hesitant to recommend vaping products. What they try to do is get their patients off of nicotine as quick as possible, because they have a belief that nicotine causes an amount of health problems that it doesn't actually cause, and also health benefits that they believe it has, which it doesn't. So, for instance, the belief of many doctors that were asked in the survey believe that nicotine causes lung damage. So I think the nicotine misconceptions are unfortunate. What happens, though, is that the general practitioners do say that they do want to learn more about new findings on nicotine, both benefits and disadvantages to nicotine use, and they want to take that into account for their future recommendations. So I think what we deal with is a lack of awareness and a lack of communication within sort of the communities of general practitioners on the use of vaping as a harm reduction tool, but also as regarding the use of nicotine. So sorry if that was a bit of a long answer, but yeah, that's as much as I can tell you.
Yeah, that's all right. Thank you so much, Bill. Michael, could you please comment on the misperceptions about vaping and nicotine among smokers and how it impacts their decision to quit?
Sure, thank you. So basically that was the second part of the whole survey, where we directly ask smokers about their conceptions about different products, about nicotine, quite similar, but more smokers, we said we want to know from the smokers, because obviously this is the group who is most affected by misconceptions, because that can hinder their way forward or how they try to quit smoking. And that's why I would like to start with the second part of the question, actually, the impact those misconceptions have. Some of you might know, I personally know, quitting smoking is one of the hardest things to do, and only 2 to 3% of smokers successfully quit without any help. And we still see 700,000 smoking-related deaths in the EU, so it's a really serious problem, and we thought we need to understand this misconception so that then policymakers can base their decisions on how to help smokers to quit. And I think there are 3 key elements which we always need to have in our head when it comes to helping smokers quit cigarettes. Obviously, the first one is to have options. We have already heard all smokers are different, all people are different, so we need to have as many ways away from cigarettes as possible. That is kind of a policy requisite for having a consumer-friendly regulatory framework, so that for some it works cold turkey, or actually only a few. For some in the Nordic countries, snus works great, and as it turns out, vaping is one of the most successful smoking cessation aids. But obviously everything, or for every person, different things are working, so we need to have that on the table. And obviously, to make sure that the smokers can make the right decision for themselves, they need to have accurate information about those kind of things. And as we said, the problem also starts a little bit with the doctors on the one side, but also the way public health provides smoking cessation aids. Because we found that 4/5 of all smokers in our survey tried to quit smoking but failed. And in France, 62%, and in Germany, 53% of the smokers believe that the anti-smoking policies, the way we provide them, ignore the fact how hard it is to quit smoking. And therefore, I think we need to rethink how we approach this, and this is obviously with as much choice as possible. And now to some of the concrete findings, and I just picked a few out of them. All of them are in the reports. But I think the most problematic one is that in France, still 33% of smokers, and in Germany, 43% of smokers believe that vaping is at least as harmful as smoking or even more harmful than smoking. And then as a side note, in Germany, more than 20% of smokers don't know what vaping is at all. So they are not even aware that there are alternatives to just trying to quit without any help. And that obviously hinders a lot of people from switching from smoking to an alternative. And the other astonishing number for me is almost 70% in France and more than 70% in Germany, also from the smokers, believe that nicotine causes cancer. And obviously Professor Fasalinos is more prepared to show the actual scientific status quo, but I think it's fair to say that it's generally accepted that vaping is less harmful compared to smoking. And therefore it's a disaster that even the smokers, those we want to target and help to get away from cigarettes, have such high amount of misconceptions and misinformation actually. One of the things was 11% of in both countries of the smokers actually think that cigarettes are the least harmful product out of all the alternatives we gave them, which included snus, oral pouches, vaping. So there is a lot of misinformation with real life impact because that hinders people. Apart from price, probably the improvement of one's own health is one of the key motivating factors of smokers to switch away. And if they think the other product is as harmful or even more harmful, obviously this motivation is decreased. So I think this is where policy also needs to start working on to give this accurate information. And we see good examples like in the UK that it can change things when public health agencies and politicians actively encourage smokers to switch. And even if we look in our numbers, the comparison between Germany and France, where I would say France's vaping policy is far from perfect, but it's more open compared to Germany, and there you see the difference as well. You have 10 percentage points fewer smokers believing that vaping is as harmful or more harmful than vaping, and even 15% fewer percentage points fewer who don't know vaping at all. So public health policy makes a difference, and therefore we as a consumer organization always encouraging policymakers to finally do that and fully embrace tobacco harm reduction and encourage smokers to switch to vaping or other alternatives.
Thanks, Michael. We can talk also a little bit about electronic cigarettes. Mr. Farzalinos, could you comment on the actual scientific evidence of electronic cigarettes and their role in tobacco harm reduction?
Yes, thank you very much for the invitation. Harm reduction is a strategy that we follow in our daily lives, in almost all our daily activities. Harm reduction is the use of seat belts instead of not entering a car. Harm reduction is the use of helmets instead of not driving a motorcycle. With seat belts and with helmets, you don't reduce your risk of being injured in a car crash or in an accident to zero, but you substantially reduce your risk. This is exactly the concept and the definition of harm reduction. In the same way, electronic cigarettes represent a perfect example of harm reduction. They are not risk-free, and that's why no one recommends to a non-smoker to start using electronic cigarettes. We always recommend that there should be regulation, but there is growing evidence, and right now we have more than 10-15 years of experience through a lot of research. And when you look at the totality of evidence, and not specifically to each study, there is no doubt that there is a vast difference in risk associated with e-cigarette use compared to smoking. There is a huge risk reduction that is being proven every day. Additionally, we now have evidence that they do help quite a lot smokers to quit. For example, a few years ago, a study showed that it's twice as effective as nicotine replacement therapies, which are approved smoking cessation medications. Very recently, a few days ago, a study in 4 countries, the UK, Australia, Canada, and the US, found that people who start using electronic cigarettes daily have 8 times more chance of quitting smoking. So they do work as smoking cessation tools. But the problem is the misconceptions that were presented in this study, which is something very disappointing, but also very much expected. In 2016, we published a study about the perceptions of healthcare professionals in Greece about nicotine, tobacco, smoking, and electronic cigarettes. And the findings were almost the same. There are similar studies with Swedish general practitioners. There are studies of physicians in the UK a few years ago, and they all show the same misconceptions, not just among the society, the citizens, but among experts, healthcare professionals who are the source of information and advice for everyone. So when you see that there are such misconceptions, like, for example, in our study, we found something very similar to what you found, that more than 70% of healthcare professionals believed that the contribution of nicotine to smoking-related lung cancer and cancer in other organs is important to extremely important, while nicotine is not a carcinogen. We know that. We know that for many years. It's not registered as a carcinogenic substance in the International Agency for Research on Cancer. So when you see such kind of misconception within the medical community, then I think it's not a surprise that you see the citizens, and especially smokers, not knowing what to believe and having such erroneous opinions about these products. In 2017 in Greece, among smokers, only 5% believed that electronic cigarettes are by far less harmful than smoking, which is the correct response when you ask someone what's the relative risk of electronic cigarettes compared to smoking. Because we also need to quantify the difference. You know, when we say less harmful, you know, it may be slightly less harmful, which has no clinical meaning, but there may be a vast difference, which is the case right now. But I'm seeing, and we also heard a story from a physician, that they find it hard to recommend vaping because it's not a medically approved and medically supervised method of quitting. Well, I think that physicians are doing this every day. They are recommending not medically supervised interventions. For example, when you tell someone to improve their dietary habits, to reduce meat intake, to increase vegetable intake, that's not a medically supervised intervention. When you tell someone to exercise, it's not medically supervised, but you provide advice. When you tell someone to reduce sugar intake and use, for example, other sugar substitutes, you don't expect to have a study showing that using sugar substitutes reduces, for example, the risk of developing diabetes or not. You use common sense, and as a physician, you recommend to those who have diabetes or who are at risk of developing diabetes, or to obese people, to reduce their sugar intake and use supplements. We are doing that because one of the medical interventions is to improve our lifestyle. And unfortunately, smoking is a very bad lifestyle choice. And yes, we do have medications, which should be the first line treatment. But unfortunately, for the vast majority of smokers, about 70% or even more, they fail. People either don't quit at all, or they relapse back to smoking very rapidly. So we need to have an additional tool, and that's the role of harm reduction and products like electronic cigarettes, to provide some advice to these smokers to change their lifestyle and to use the electronic cigarette as a consumer lifestyle product, but in order to substitute for smoking, in order to reduce or ideally to quit smoking. And we already have evidence that several prognostic factors that are associated with the risk of developing future disease are substantially improved when people switch from smoking to electronic cigarette use. There are studies on asthmatic patients that their lung function improves. There are 2 studies on cardiovascular risk factors. For example, the function of the vessel wall, of the arterial wall, it improves within 4 weeks of switching from smoking to electronic cigarette use containing nicotine, the electronic cigarettes which contain nicotine. So I think we need to be more realistic to understand that yes, ideally no one should quit and everyone should quit, every smoker should quit by themselves or with medications. It's not happening for the past 60 years that we know that smoking is extremely harmful. So we need to have a realistic approach. We need to increase options for all smokers, and using electronic cigarettes with a variety of devices, flavors, nicotine strengths is one of the fits perfectly to the definition of harm reduction and is needed in order to satisfy the preference of the most possible smokers and help them get rid of a very, very bad habit and a very bad lifestyle choice. Thank you.
Thank you so much, Dr. Farzalinos. And Mr. Kvitashvili, how, in your opinion, such misperceptions about nicotine and vaping in the leading EU countries impact the global approach to harm reduction?
Thank you. Thank you for having me here. I think Professor Farzalinos just mentioned really good examples of what the harm reduction really means, and whether it's medically supervised or non-medically supervised. For example, I'll give you another example, one more, on the drug addiction, which has been widely used worldwide, and it's a drug substitute program, methadone, which obviously is not recommended as a standalone substance to use for non-drug addicts, but it's one of the successful ones. And there are a lot of other harm reduction policies and programs that have been around. For example, needle exchange for the HIV patients. A lot of things that prove that you are moving towards less risky ways of dealing with things, which you cannot stop happening or as a fact they're around. For the policymakers, usually, and I'm looking at the more of a developing countries where smoking is a far more widespread than in the developed countries for many reasons. And if you look at the countries that are enacting new policies, they usually look at the EU and the advanced countries to come up with the solutions for the problems that they have. At this point, the countries that I work with, which is mostly Southern Caucasus, Eastern Europe, Asian countries, Central Asian countries, they do take European regulations as some kind of blueprint to build their own policies on that. And when and if the European policies are based on misconceptions or unknown or misrepresentation of the facts, then it has a much worse effect on the countries which are not financially as strong as the European ones or the developed ones. And I'll give you a couple of examples. Many countries followed in the developing world a 300%, 400%, 500% increase in excise tax on tobacco and tobacco products. Again, I'm not a proponent of smoking, but that didn't solve the issue of reducing the number of smoking. What it did, it created another issue of illegal markets and illegal smuggling of cigarettes. It's a very simple thing. Over regulating certain fields in this particular case may harm the very foundation of the good cause that it was started with. So policy making in the European countries is essential for the other countries to move towards that, but it has to be based on the evidence, on the knowledge, on the factual information that is out there. The study, which I think is extremely important for this particular reason, shows the ignorance or lack of knowledge from the health professionals, which is a serious problem, because then most of the policies are based on the recommendations of the health professionals. And we've gone through, there are many examples of building these policy portfolios based on wrong understanding of things. From, for example, overuse of antibiotics, And that's thankfully, that's been changing around the world, because antibiotics were considered as the solution for everything, maybe 30, 40, 50 years ago. Now we're moving towards not using them. And again, those changes in policies are based on the evidence that the current modern times gives us. Currently, obviously, the vaping, which is becoming a point of debate in many countries, because they can't really see which way it should be going, whether it's a tobacco product, what is it, and how you define this. That actually prevents or brings in some policy decisions which are actually harmful to those that would like to quit smoking, and this study actually shows that. So what we need to do is we need to put that information out there, put the factual information out there, so the policymakers in Europe and EU and other developing countries are coming up with something more progressive, which then can be used globally, because these countries are leaders in research, in development, in medicine, in everything, and many of them serve as an example for the others. So I commend you with a very, very interesting and good work, and very useful, and hopefully we'll start moving towards sane policies in the future around the world. Thank you.
Thank you so much, Mr. Kvitashvili. Do we have questions from the audience? Giuseppe. Okay, Emil.
Sure. I have a question in terms of, so the study concludes by looking at medical licensing as one possible solution for streamlining support for vaping, for doctors, but knowing a comparative case from the UK with the MHRA, the regulatory agency there, they've struggled to be able to actually get medical licensing closer to, term, because right now it takes years and years and very costly, so that none of the actual big vaping firms have applied for medical licensing in the UK. So what do you think would be a good solution in terms of bringing that forward, making that official for the licensing market?
I think following the pharmaceutical or medicinal route is a pretty bad idea, for a simple reason. These are products that are used as consumer products. The pharmaceuticals have some specific criteria, and that's why we call them pharmaceuticals. First of all, they have everyone has a dose range, a specific dose range. When you prescribe anything from an antihypertensive to an antibiotic, there is the minimum and maximum dose. This doesn't happen with nicotine and with nicotine-containing products. Why? Because the brain self-regulates the amount of nicotine intake according to its own needs. And every smoker has different needs. That's why every smoker smokes the cigarette differently. They not only use different cigarettes, but even the same cigarette can be smoked very differently between two smokers, and two smokers can get very different levels of nicotine in their blood and in their brain. So I don't think that it's appropriate to use a medicinal regulation for a product that is not being used as a medication, but it's being used as a consumer product. And that's why I think, combined with the cost and the complexity of the medicinal regulation, that's why, as you correctly mentioned, no one has applied for a medical license. I think that what a medical license would create is another useless nicotine replacement therapy product. And unfortunately, I'm calling NRTs useless because if you look at real world data and their impact in smoking cessation, it's extremely low. Their efficacy is very low, about 5%, 7% of smokers quit with the use of NRTs. But additionally, smokers don't like them, they don't want to use them. Despite being subsidized in many countries, they get it for free. And despite being available over the counter. You can find studies, real world studies, that they have almost no impact. So, unfortunately, we need to understand that the medicinal route is going to fail. Thankfully, the EU acknowledged that in 2013 when they initiated the negotiation for the current Tobacco Products Directive. And I think that It should be left as an option if someone wants to, but we should not rely on a medicinal regulation for these products.
And may I just add, from the consumer perspective as well, it's like smokers don't feel like they are sick and need medicine. They are. It's more like this effect what we see with a lot of vapers, that they just find out that this exists and try it and accidentally quit actually because they prefer the vaping and didn't even plan to quit smoking. So if we would solely put it as a medical product, then this falls away, and also the easy access for regular consumers must still be there, because then otherwise we lose all these accidental quitters, which we definitely shouldn't.
Giuseppe, Peter, yes.
Yes, what I learned this week regarding snus is that apparently, which I did not know, that there are some health downsides to snus, that they have been able to prove that certain cancers are slightly higher among snus users. Even of course in Sweden, where it's legal, the cancer rates are much lower. But also interestingly, I was told that, and then I checked it on the website of Cancer Research UK, that there's no proven health damage from vaping. So I was just wondering if you know more about this. Basically, Cancer Research UK was saying yes, it has not been proven that there's any health damage from vaping, but we still don't know entirely, so we recommend that you don't start if you're not already doing it. So do you have some more background on that, please?
Well, this is exactly what I said, and I fully agree with what Cancer UK says, that there is no reason for a non-smoker to initiate e-cigarette use. The only exception would be someone who has quit smoking and is on the verge of relapsing back to smoking. There are many people who were about to relapse to smoking and they have used electronic cigarettes in order to prevent relapse back to smoking. But other than that, the Cancer UK has a very reasonable approach. About snus, you know, it's ironic. We live in the European Union where tobacco cigarette sales are legal and snus sales is illegal. It makes zero sense. Sweden is a case of a country with so much hardcore epidemiological evidence on snus use that it's undisputed. There are several epidemiological studies on humans. We're not talking about laboratory studies, cells, animals, and so on. Why? Because snus has been available for decades in Sweden, so there was the time necessary to develop that kind of data, showing that it has minimal, if any, cardiovascular risk, minimal, if any, cancer risk. There are some studies saying that, for example, cancer of the pancreas is slightly increased by snus, maybe of prostate cancer too, but we're talking about a minimal risk compared to the risk of smoking. And we have seen in Sweden and in other Scandinavian countries, especially that among men, snus has substituted for smoking. The smoking rates in Sweden are 5%. But if you look at nicotine use rates and tobacco use rates, they are very high. Still, Sweden has 2 or 3 times lower death rates from cardiovascular disease, from lung cancer, and from cancer in other organs. So you see that it doesn't matter what the nicotine use rate or the tobacco use rate is in the population. What matters is the smoking rate. And these products, and electronic cigarettes, of course, which are available in the rest of the EU, serve as a smoking cessation tool. It's not a medication, but it helps people quit. And we do have now published studies showing that it helps people quit. It's not just our personal, experience or what we know from people we know or from our families. So, yes, it's not a risk-free product. Even though, and I agree with Cancer UK that there are no data on the harm caused by electronic cigarettes, you cannot be sure about everything and about even very, very minimal harms. But we do have more than 10 to 15 years of experience now, global experience, with millions of e-cigarette users who have been using these products for years. And we haven't seen anything coming up which is due to vaping. I will mention the EVALI case in the US, which was a misnomer because EVALI was acute damage to the lungs caused by, initially they said vaping, and that's why they called it electronic cigarette or vaping induced lung injury, vaping associated lung injury, but it turned out to be illegal, illicit, black market marijuana THC products, which were adulterated with vitamin E, which is cheaper than THC oils, and vitamin E acetate appears to be the reason for this acute lung damage. Let me then also reassure you that vitamin E acetate cannot be used in electronic cigarette liquids because it cannot be dissolved in the liquid. It's like mixing water with oil. Nicotine liquids are water soluble. Vitamin E is not water soluble, it's water insoluble. So even if you add vitamin E to any liquid, it will separate, it will create a separate layer, similar to mixing oil with water. So the Cancer UK is right, despite not having any evidence of any harm caused by electronic cigarettes. And there was also a study a couple of years ago which tested this situation with vapers who have never smoked, and they followed them up for 5 years, and they did several tests in the lungs. And over 5 years, these vapers who had never smoked did not have any changes in the lungs associated with any sort of damage caused by vaping. But still, we need to be cautious. We're not recommended e-cigarettes or nicotine use to everyone, only to smokers or to former smokers who risk relapsing as a smoking cessation and smoking prevention tool. And that's, I think, what the regulator should present as a message, both to the healthcare community and to the citizens, because unfortunately I think that public health has done something very wrong, seeing that level of misconception, which remains stable, if not growing over time, despite the added evidence on the exact opposite of what the study has showed, that of the lower risk potential of electronic cigarettes.
All right, Giuseppe?
Yeah, my question is more on policy side. So my impression is that the most important problem here is fragmentation. So fragmentation of policy, lack of knowledge, lack of information, and also in terms of taxation in the country. So my question is, based on this scenario and the fact that my opinion is that at least at EU level we will need a more harmonized approach on that. But this collides with the fact that the public policy, public health is in the hands of the member states. So we are a bit in a paradox here. So where do we start in order to change things?
Yeah, I'll say a few words. Very good point, and I would remind you of the recent COVID situation, that the reaction was knee-jerk reaction to everything, and countries copied each other. From a total lockdown, for some reason Sweden was not popular with the no lockdown. Everybody copied the full lockdown or crazy things, right? Many of the things were done that had no evidence of those things to be useful or preventable or useful in preventing the spread of COVID, right? So this is, I won't put it in the same, but it's a good example of how the reaction to certain things are. Again, I mean, the importance with this particular study is done in Germany and France, which are the leading opinion makers in the EU. And that's, if those two countries show that there is ignorance and lack of knowledge from the medical professionals, not the consumers, because consumers can be completely fooled in many ways. And health in general, as I always say, is not a real market economy type of business where consumers have absolutely zero participation in choosing the product they want to buy. It's completely driven by the supply. Okay, so if we see that kind of misconception, then this will be or could be the basis for policies which will not be helpful in general, within the EU for those that want to quit smoking. Because again, we're not advocating this product as something that should be purchased and consumed like Diet Coke or something. But again, it's a good example is Diet Coke, no sugar Coke and Coke, right? Now, to me, the approach is if I don't want to have sugar products, sugar Coke, I don't drink Coke, period. So I don't understand the concept of non-alcoholic beer as well. But that's the sidetrack. So the problem is that if we are seeing that this type of situation is in the most leading countries of the European Union, would actually have probably contributed the most in creating the public health policy in the EU region, then we should expect that some let's say not too smart policies will be enacted, and that then they'll be copied around the world, and we're going to end up in situations that we've seen recently with COVID. Thank you.
I would add something. I think the general problem and benefit to harmonization is you end up harmonizing the errors or harmonizing the benefits.
Right.
And I think that in this case specifically, what we see is that there's quite some divergence between member states how they approach it. We see that already with France and Germany, and now the Netherlands that wants to go down the path of banning flavors, even though that was not recommended by any supranational institution. I think what we first need to get to before we talk about harmonization is sort of a common knowledge basis. It's a bit like in foreign policy. There should be no common foreign policy decisions before Mr. Orban understands that Mr. Putin is bad. Before he understands that there can't be, we can't harmonize those things. I think that's the same problem here. Before everyone has understood the benefits of vaping as a harm reduction tool, it's going to be difficult to get sort of a common line. And if the misperceptions persist in the European Parliament, for instance, then what we're going to do is undo many of the positive things that have been done in some member states. I think that would be the big risk. So I think we need to first get on a common knowledge basis before we can talk about sort of how do we streamline those decisions and make them generalized.
Just one sentence, because we included it as well in the paper. We shouldn't completely forget the building right next to us, the European Parliament, and ESIG Intelligence did a survey among MEPs, and there it came out that 1/3 of all MEPs don't know anything about any tobacco harm reduction product. And even though, yes, it is important to get this common ground, but with the Tobacco Products Directive coming up, the most important regulatory fields will be decided by the European Parliament in the next year or 2 years. So I think it is also very important to focus on the EU level and to educate there the decision makers, because as we have written in the paper, there is a lot of misconceptions and lack of knowledge in the European Parliament. But nevertheless, they still want to regulate it.
I don't think that the problem is the need or the intention to regulate. All consumer products are regulated. This should be also regulated even for more reasons, because, for example, we should target only smokers with this product and not the whole consumer market. But here in the EU, I think we are risking making huge steps back with the new TPD. The first Tobacco Product Directive, and I was here and I presented in the European Parliament one of the very few studies that I did at that time, because the initial proposals had some crazy ideas about nicotine limits that had nothing to do with reality. The initial TPD, the final version, was not bad. It was not ideal, of course. There was room for improvement, but at the end it was not bad. And that's why, in fact, I advocated for many countries to use the EU regulation, outside the EU, in Asia, to use the EU regulation as a basis to set their regulatory framework. But I think that what's happening in Europe is that there is an abuse of the precautionary principle. Mm-hmm. They are overusing it despite having several years. The original TPD, the TPD that we have now, was voted in 2014. And it was implemented in all member states in 2016. We have 6 years of experience. Did you see anything bad coming out from this regulation? Why regulating even more strictly, over-regulating, creating a more restrictive regulation for a product that didn't create any problem all these years? we didn't see not even accidents, from accidental exposure to something or accidental use of a bad ingredient or whatever. Nothing bad happened. But there is so much dedication to the precautionary principle to an unimaginative level that, after 10, 15 years of knowledge and experience, you still hear views that you don't know what's going to happen in the future. Well, after 10 years more, we're still going to have a lot of future, and it doesn't make sense to still use the precautionary principle that, but in the future we may see something bad. I think we need to be realistic and understand that this is a product that is used to combat a very serious problem in the EU. And I agree with you that there are many countries in Asia, especially, or in Eastern Europe that have much higher smoking rates than the EU. But still, in the European Union every year, 700,000 people die prematurely because of smoking. And the smoking rates at 25, 26% is not that low. It's quite high. And the economic cost, from smoking, not only from the deaths, but from disability, from morbidity, from loss of work, it's tremendous. It's probably trillions of euros. So we do have a problem, and this is a tool to combat a specific problem. We need to apply the precautionary principle against smoking, not against these products, And we need to have a regulation that creates a competitive advantage for these products. It doesn't make sense. In regulating everything, everyone in the world is using the risk proportionate principle. The higher the risk, the more restrictive the regulation. The lower the risk, the less restrictive the regulation. This is exactly what we should do with these products. It's not anything new. We don't need to reinvent regulatory policies and regulatory strategies. Just use this principle. Look at the totality of evidence, use this principle, and try to correct the mistakes of the previous TPD instead of adding more hurdles and more problems to the legislation. I'm afraid that the intentions right now are to add more negative effects of the regulation, over-restricting the products, which is contrary to what we should have been doing.
All right. I think since we don't have any more questions, thank you so much everyone for coming. Please get your copy of the paper. Feel free to distribute it among your colleagues. And we'll see you soon. Thank you so much.
Thank you.